Have you ever been sitting quietly in the evening, maybe watching something on television or reading, and become aware of a sound? Not a loud sound. Not an alarming sound. Just a persistent, rhythmic, wet sound coming from somewhere near the floor. And when you look down, there is your dog. Lying on their side or curled in their bed, completely absorbed in licking one paw. Over and over. The same paw. The same spot. With a focused, almost compulsive dedication that seems completely disconnected from anything happening in the room around them. You said their name. Maybe they looked up for a second. And then looked back down and continued. So you went back to what you were doing. Because dogs lick their paws sometimes. Everybody knows that. It is just grooming. It is just what they do. But then it happened again the next evening. And the one after that. And somewhere around the fourth or fifth evening you started really looking at the paw they keep returning to. And what you saw made you lean closer. The fur between the toes is darker than it should be. Not dirty darker. Stained darker. A reddish-brown color that was not there before, that was not there last month, that has appeared gradually from weeks of repeated wet contact with saliva. And the skin underneath, when you gently part the fur to look at it, is pink. Or red. Or raw in a way that makes you wince slightly. And your dog is still licking it. You tried to redirect them. You gave them a toy. You called them to a different room. And they followed you, settled for a few minutes, and then quietly, without drama, went back to licking the same paw in the same spot. And now the comfortable explanation that it is just what dogs do is not sitting as comfortably anymore. Because what dogs do does not leave a stain. What dogs do does not make the skin underneath red and raw. What dogs do does not happen at the same spot, every evening, with that particular quality of compulsion that makes it feel less like grooming and more like something your dog cannot stop doing even when they might want to. Your dog is not grooming that paw. They are trying to relieve something. And the thing they are trying to relieve has a cause. Possibly several causes. And not a single one of them resolves on its own while your dog continues licking. Tonight you are going to find out exactly what it is. Hello everyone. I am Dr. Amanda Foster, and welcome back to Paw Secrets Lab. I have spent over 13 years in veterinary dermatology and internal medicine. And I want to tell you something that changes the entire way you should think about paw licking in dogs. Paw licking is not a behavior. It is a symptom. And treating it as a behavior, trying to redirect it, using bitter sprays, putting socks on the paw, without identifying and addressing the underlying cause, is the equivalent of turning off a smoke alarm while the fire is still burning. Every week in clinical practice I see dogs whose paw licking has been managed as a behavior problem for months or years while the underlying condition progressed, untreated, underneath. The paw became increasingly damaged. The skin became increasingly compromised. Secondary infections established themselves. And what started as a manageable, early-stage condition became significantly more complex and significantly more difficult to resolve simply because the symptom was treated rather than the cause. What if I told you that excessive paw licking in dogs is almost always driven by one of 6 specific, identifiable, treatable underlying causes? And what if each of those causes has a precise set of accompanying signals that you can observe at home tonight that tells you not just that something is wrong but specifically what is wrong and how urgently it needs professional attention? Today at Paw Secrets Lab, we are going to identify the cause together. Here is exactly what we are covering. In Chapter 1, I am going to explain the paw licking biology. You are going to understand exactly what drives a dog to lick a specific spot repeatedly, and why the location, the pattern, and the quality of the licking are the most important diagnostic details available to you. In Chapter 2, I am going to reveal the 6 underlying causes. These are the 6 specific conditions most commonly responsible for excessive paw licking in dogs, each with its own distinguishing characteristics and its own required response. In Chapter 3, I am going to teach you the Paw Assessment Protocol. This is the specific 5-minute examination you perform on your dog's paws tonight that identifies which cause is most likely driving the behavior and what to do next. And in Chapter 4 I will give you the warning signs that tell you the paw situation has already progressed to a point requiring urgent veterinary attention today. Subscribe to Paw Secrets Lab right now and join our incredible, growing community of educated, devoted dog parents. Get something to write with because what you learned tonight is going to completely change how you respond to this behavior from this point forward. Let us begin. Welcome to Chapter 1. The Paw Licking Biology. To understand why your dog licks their paws excessively and what that licking is communicating about their body, we need to understand what drives repetitive self-directed licking behavior in dogs at a neurological and physiological level. Dogs lick themselves for several completely normal reasons. Brief post-walk paw cleaning. Grooming after contact with a foreign substance. Wound care following a minor injury. These normal licking episodes share two characteristics that distinguish them from problematic licking. They are brief, ending within seconds to a minute or two once the immediate trigger is addressed. And they resolve. The dog licks, the trigger is addressed, the licking stops, and the paw is not returned to repeatedly throughout the day. Excessive, repetitive paw licking that returns to the same location session after session is driven by something completely different. It is driven by a persistent, unresolved sensory input that the dog's nervous system is registering as requiring a response. That sensory input is almost always one of two types. Either an itch signal, which is a neurological signal generated by the release of inflammatory mediators in the skin tissue, or a pain signal, which is generated by tissue damage, nerve irritation, or structural abnormality in the paw. Here is the critical piece of information about both of these signals. Licking provides temporary relief from both of them. And this is why excessive paw licking is so persistent and so difficult to interrupt once it is established. When a dog licks an itching or painful area, several things happen simultaneously. The mechanical stimulation of the tongue on the skin temporarily overrides the itch signal in the nerve pathway, a phenomenon called gate control, where one sensory signal temporarily blocks another competing signal in the same pathway. The moisture and warmth of the saliva temporarily soothes inflamed or irritated skin. And the licking behavior itself triggers the release of endorphins, the body's own pain and discomfort-reducing neurochemicals, in the dog's brain. The licking genuinely makes the dog feel temporarily better. But only temporarily. Because none of these mechanisms address the underlying cause of the itch or pain signal. The inflammatory mediators are still present. The allergen is still in contact with the skin. The infection is still active. The structural problem is still there. The temporary relief fades. The signal returns. And the dog returns to licking. This is how a brief episode of paw licking becomes a chronic, compulsive pattern. Not because the dog has developed a behavioral problem, but because the underlying physiological signal driving the licking has never been resolved. Each licking session provides temporary relief followed by return of the signal. And because licking provides relief, the behavior is neurologically reinforced with every session. The pathway between stimulus and licking response becomes more established with every repetition. There is an additional layer of damage being done simultaneously that most owners do not realize. Dog saliva contains a specific enzyme called lysozyme that, while antibacterial in small amounts, becomes actively damaging to skin tissue in continuous, excessive contact. Chronic saliva exposure breaks down the skin barrier, increases skin permeability, and creates an environment that is ideally hospitable to bacterial and yeast colonization. The licking that started as a response to an underlying condition becomes, over time, a cause of secondary infection that layers new discomfort on top of the original signal and makes the overall condition progressively harder to resolve. The reddish-brown fur staining you observe between your dog's toes is caused by a pigment called porphyrin that is present in dog saliva. The intensity of the staining is a direct visual record of how much time has been spent licking that area. Dark, deeply saturated staining indicates weeks to months of repeated saliva contact. It is a biological timestamp of how long this has been happening. And that timestamp is clinically important because it tells you that whatever is driving this behavior has been present for long enough to need professional attention. Welcome to Chapter 2. What is actually driving the licking? I am going to walk you through each of the 6 most common underlying causes of excessive paw licking in dogs. For each cause I will give you the specific distinguishing characteristics that separate it from the others so your home assessment can be targeted and precise. Underlying cause number 1. Environmental allergies. Environmental allergies, technically called atopic dermatitis, are the most common cause of excessive paw licking in dogs and affect an estimated 10 to 15% of the dog population. The dog's immune system develops a hypersensitive response to environmental proteins called allergens. These include grass pollen, tree pollen, dust mites, mold spores, and a wide range of other airborne and contact proteins that are completely harmless to non-allergic dogs. When an allergic dog walks across grass, when they lie on a carpet that harbors dust mites, when they are exposed to seasonal pollen, their immune system triggers an inflammatory response in the skin that produces intense itching. And the paws are among the most heavily exposed areas of the body to environmental contact allergens. Every step on grass, every contact with the floor surface, every outdoor walk delivers allergen directly to the paw skin. The distinguishing characteristics of environmental allergy, as the driver of paw licking, are these. The licking affects multiple paws rather than a single paw. Allergic itching is typically bilateral and distributed, affecting both front paws, or all four paws, rather than targeting one specific paw. The condition is often seasonal in its early stages, worse during spring and fall pollen seasons and improved in winter, though it frequently becomes year-round as the dog ages and sensitizes to additional allergens. The paw licking is accompanied by other allergy manifestations elsewhere on the body. Face rubbing, ear scratching, belly redness, armpit inflammation. These additional signs alongside paw licking create a body-wide allergy picture that is diagnostically distinctive. And the condition began gradually rather than suddenly, and has been progressive over months. Underlying cause number 2. Food allergy. Food allergy in dogs is frequently confused with environmental allergy because the skin symptoms it produces are nearly identical. But the critical distinguishing characteristic of food allergy is its complete lack of seasonality. Food allergy symptoms are present year-round with no seasonal variation because the allergen, the specific dietary protein triggering the immune response, is consumed at every meal regardless of the time of year. The most common food allergens in dogs are beef, chicken, dairy products, wheat, and eggs. These are proteins that the dog has typically consumed for extended periods before the allergy develops, because food allergies require repeated exposure to sensitize the immune system. A dog that has eaten the same chicken-based food for 3 years can develop a food allergy to chicken protein at any point in that period. The distinguishing signals of food allergy alongside paw licking are these. Year-round symptoms with no seasonal variation or improvement. Gastrointestinal symptoms occurring alongside the skin symptoms, loose stool, intermittent vomiting, increased flatulence. These digestive signs alongside skin signs are strongly suggestive of food allergy rather than environmental allergy. And a history of diet changes that have produced no improvement because the new food contained the same allergen protein under a different name or in a different form. Underlying cause number 3. Contact dermatitis. Contact dermatitis is the simplest and most directly mechanical of the 6 causes. It occurs when the paw skin comes into direct contact with a substance that either irritates the skin chemically or triggers an immune response in sensitized individuals. Common culprits include lawn chemicals including pesticides, herbicides, and fertilizers. De-icing salts used on winter roads and pavements. Cleaning products used on floors and surfaces the dog walks on. And certain grass species that produce a contact irritant response in sensitive dogs. The defining characteristic of contact dermatitis that separates it cleanly from the other causes is its distribution pattern. Contact dermatitis affects only the areas of the paw that make direct contact with the irritant. Specifically the pads and the skin between the toes on the underside of the paw rather than the dorsal surface or the areas above the paw that do not contact the ground. And the onset is typically acute rather than gradual. You can often identify the specific walk, the specific surface, or the specific cleaning event that preceded the onset of licking. Underlying cause number 4. Interdigital cysts and furunculosis. Interdigital cysts are fluid-filled or tissue-filled nodules that develop in the webbing between a dog's toes. They are more accurately called interdigital furuncles when they involve infection and tissue breakdown, and they are simultaneously one of the most painful and most commonly overlooked causes of paw licking in dogs. These lesions develop when hair follicles in the interdigital skin become occluded, typically by the mechanical pressure of walking or by the ingrown growth of coarse interdigital hairs. The occluded follicle becomes infected, expands, and forms a painful, pressurized nodule in the tender webbing between the toes. The pain drives intense, focused licking specifically between the affected toes. And the licking drives further infection and further nodule development in a cycle that is extremely difficult to break without veterinary intervention. The distinguishing characteristic of interdigital furunculosis is the specificity of the licking. Unlike allergic paw licking, which affects multiple paws diffusely, interdigital furunculosis drives licking that is intensely focused between specific toes on a specific paw. When you part the fur and examine the webbing between the toes of the affected paw, you will see one or more reddened, raised, dome-shaped swellings in the tissue that may have a small opening or discharge point. These lesions are painful when touched. Your dog will react when you press on them, and they will not resolve without appropriate antibacterial and anti-inflammatory treatment. Underlying cause number 5. Yeast infection of the paw. Malassezia yeast, which we discussed in our skin condition video in the context of generalized dermatitis, has a particular affinity for the warm, moist, enclosed environment between dogs' toes. When yeast populations overgrow in the interdigital spaces, they produce intense itching and a characteristic inflammatory response that drives persistent, focused paw licking. The distinguishing characteristic of yeast paw infection is sensory rather than visual. Lean close to the paw that your dog is licking and smell the skin between the toes. A yeast-infected paw has a distinctive, unmistakable odor. The same musty, corn chip, slightly fermented smell that we discussed in the context of yeast skin conditions elsewhere on the body. If you detect this odor between your dog's toes, you have identified yeast involvement with a high degree of certainty. Visual signs accompanying the odor include brown or rust-colored staining of the fur between the toes, even in light-colored dogs, reddened and slightly thickened skin between the toes, and a greasy texture to the skin's surface when you touch it. Underlying cause number 6. Anxiety and psychological stress. This cause is real, it is documented in the behavioral research literature, and it is significantly less common as a primary driver of paw licking than the 5 physical causes above. I include it because it is frequently cited as the first explanation and is frequently wrong, leading to behavioral management of a condition that is actually physical in origin. Please work through the other 5 causes before accepting anxiety as the explanation for your dog's paw licking. Genuine anxiety-driven paw licking develops as a self-soothing, repetitive behavior in dogs experiencing chronic stress. The endorphin release from licking provides genuine neurological relief from anxiety, and the behavior becomes entrenched through the same reinforcement pathway we described in Chapter 1. The distinguishing characteristics of anxiety-driven paw licking are these. The licking is not associated with any visible skin abnormality. The paw skin between the toes appears normal, non-inflamed, and odor-free on careful examination. The licking occurs specifically in the context of stressful situations, during thunderstorms, during owner absence, during high household activity periods. And the dog shows other anxiety indicators alongside the paw licking: excessive yawning, lip licking, panting without heat, hypervigilance, or destructive behavior during owner absence. Welcome to Chapter 3. The Paw Assessment Protocol. Armed with the 6 underlying causes and their distinguishing characteristics, I am going to walk you through a precise 5-minute home examination that tells you which cause is most likely responsible for your dog's paw licking and exactly what to do next. You need 3 things: a bright flashlight or your phone's torch, a fine-tooth comb or your fingers for parting fur, and ideally a pair of disposable gloves. Have high-value treats available throughout to keep the examination positive and your dog cooperative. Examination Step 1. Count the affected paws. Before examining the paws up close, observe which paws your dog licks most frequently. Is it one specific paw, always the same one, with the others largely ignored? Or does the licking affect multiple paws, sometimes all 4, in a distributed pattern? Single paw licking with high specificity, always the same paw, always the same area, points strongly toward contact dermatitis, interdigital furunculosis, foreign body, or localized injury. Distributed multiple paw licking points strongly toward environmental allergy, food allergy, or yeast infection. Record which paws are affected and how consistently. Examination Step 2. The interdigital visual inspection. Take each affected paw and part the fur and the webbing between every pair of toes using your fingers or the fine-tooth comb. Shine the flashlight directly into each interdigital space. You are looking for 4 specific findings. First, any reddened, raised, dome-shaped swellings that indicate interdigital furunculosis. Second, any discharge, crusting, or small opening in the interdigital skin that indicates active infection. Third, the depth and distribution of the porphyrin staining. Staining only between specific toes on one paw indicates focal contact or structural cause. Staining distributed across multiple paws indicates systemic cause. Fourth, the condition of the skin surface. Normal and smooth, thickened and rough, or raw and broken down. Photograph every abnormal finding with your phone. Date the photographs. Examination Step 3. The smell test. This step requires you to lean close to the paw and smell the skin between the toes directly. I know this sounds inelegant. It is nevertheless one of the most diagnostically valuable single steps in this entire assessment. The cornchip, musty, fermented odor of Malassezia yeast infection is unmistakable once you know what you are smelling for, and it identifies yeast involvement with a reliability that visual examination alone cannot match. Normal paw skin between the toes smells like warm skin. Slightly earthy from environmental contact. Not offensive. Not distinctive. If what you smell is significantly different from this baseline, specifically if it is distinctly musty, fermented, or corn chip-like, yeast involvement is highly probable, and your veterinary appointment should specifically mention this finding. Examination Step 4. The pad and dorsal surface examination. Examine the pads of the affected paw directly. Look for any cracking, redness, raw areas, foreign material embedded in the pad surface, or swelling at the pad margins. A foreign body embedded in the pad, a grass seed, a thorn, a splinter, is a common and completely overlooked cause of persistent paw licking that produces an acutely focused licking pattern and that resolves immediately upon removal. Also examine the dorsal surface of the paw, the top surface, looking for any hive-like swellings, redness, or generalized inflammation. Dorsal surface inflammation alongside interdigital inflammation is consistent with allergic disease. Inflammation isolated to the underside of the paw and between the toes is more consistent with contact or structural causes. Examination Step 5. The seasonal and dietary history review. Think carefully about two specific historical questions. First, is there a seasonal pattern? Did the licking begin or worsen during a specific season? Does it improve at any time of year? Seasonal variation points toward environmental allergy. Year-round consistency points toward food allergy or non-allergic causes. Second, has there been any recent dietary change? Any new food, new treat, new supplement? Or conversely, has the food remained unchanged for an extended period while the licking has developed? Recent dietary change alongside new licking onset is suspicious for food reaction. Long-term unchanged diet with gradually developing licking over months is more consistent with sensitization to a protein consumed over time. Document your answers to both questions precisely and bring them to your veterinary appointment. This history is as diagnostically important as the physical examination findings. Welcome to Chapter 4. When paw licking needs urgent attention. The Paw Assessment Protocol and the 6-cause framework are designed for situations where the paw licking is chronic, progressive, and not yet producing severe tissue damage. There are specific findings that require you to contact your veterinarian today rather than scheduling a routine appointment. If your examination reveals open wounds on the paw surface, areas where the skin has broken down completely from chronic licking and the underlying tissue is exposed, these open wounds are immediate infection risks that require same-day wound management. Wrap the paw loosely with clean gauze to minimize contamination and call your veterinarian today. If you notice swelling, heat, and pain in the entire paw rather than localized findings between specific toes, this combination indicates cellulitis, which is a deep tissue bacterial infection that has spread beyond the surface skin into the deeper tissue layers. Cellulitis requires aggressive antibiotic therapy and is a same-week emergency at minimum and a same-day emergency if accompanied by fever, lethargy, or your dog refusing to bear weight on the paw. If your dog is completely non-weight-bearing on the affected paw, holding it completely off the ground and refusing to put it down, the licking has either produced or revealed a level of pain that requires same-day veterinary assessment. Do not assume the non-weight-bearing is temporary. If you find a foreign body partially embedded in the pad that you cannot remove completely and cleanly with tweezers in a single motion, do not attempt further extraction. Partial extraction of an embedded foreign body can drive it deeper into tissue and introduce further contamination. Your veterinarian needs to assess and remove it in a controlled setting. If the paw skin is cracked, bleeding, and visibly thickened to the point of hyperkeratosis, the chronic damage has progressed to a level that requires prescription topical treatment and professional assessment rather than home management. You came here tonight because a sound bothered you. A small, wet, rhythmic sound from somewhere near the floor that you heard too many evenings in a row to keep dismissing. And instead of reaching for the bitter spray or the sock or the redirect that treats the behavior without touching the cause, you came here and asked a better question. Not, how do I stop my dog from licking that paw? But, why is my dog licking that paw? That shift from stopping a behavior to understanding a signal is the most important shift a dog owner can make. And it is exactly the shift that gets your dog the help they actually need instead of the management that keeps them uncomfortable indefinitely. Your dog cannot tell you that the skin between their toes itches with a particular, unrelenting, impossible to ignore intensity. They cannot explain that the temporary relief of licking is the only tool their body has available for a sensation that their nervous system will not let them ignore. They cannot describe the difference between the burning of a yeast infection and the sharp, pressurized pain of an interdigital furuncle and the diffuse, body-wide itching of an allergic response. They cannot ask you to look more carefully at the specific paw, the specific spot, the specific pattern that would tell you everything you need to know if you knew what to look for. All they can do is lick. Quietly. Persistently. Returning to the same spot in the same evening the same way they have been returning to it for weeks. And trust that the person who hears that sound and eventually looks down will eventually look closer. Will eventually part the fur and shine a light and smell the skin and count the affected paws and ask the question that changes everything. You are asking that question tonight. Years earlier than most dog owners ever ask it. Before the secondary infection has established itself deeply. Before the skin barrier has broken down beyond management. Before the behavior has become so entrenched that addressing the underlying cause is no longer sufficient to resolve it without additional behavioral intervention. The corn chip smell noted. The interdigital swelling photographed. The seasonal pattern documented. The dietary history recorded. The paw assessment completed. These are not small things. These are the specific, targeted observations that transform a veterinary appointment from a vague complaint about too much licking into a precise, documented, multi-point clinical picture that enables your veterinarian to make accurate diagnostic decisions and begin effective treatment at the first appointment. Your dog has been licking the same spot every evening, waiting in their patient, wordless way for someone to notice and to understand. Tonight you finally understand. Tell me in the comments below. Which paw does your dog lick? Is it one specific paw or multiple? And after going through the 6 causes tonight, which one do you think is most likely driving what you are seeing? Tell me specifically and I will give you the most targeted guidance I can directly in the reply. Your observation might also be exactly what another dog owner reading these comments tonight needs to recognize the same pattern in their own home. If this masterclass replaced the behavior management approach with a cause identification approach, if it gave you a specific path forward where you had only a persistent worry and a bitter spray that never quite worked, please tap the like button. It tells the YouTube algorithm that the difference between managing symptoms and identifying causes matters in veterinary education, and it carries this video to every dog owner who has been hearing that sound in the evening and not yet knowing what to do about it. Subscribe to Paw Secrets Lab and join our extraordinary, compassionate community of educated dog parents who refuse to treat symptoms when they can find causes. I am Dr. Amanda Foster. Part that fur tonight. Shine that light. Smell that skin between the toes. Count those affected paws. And call your veterinarian this week with the most specific, documented, cause-oriented clinical picture you have ever brought to an appointment. Your dog has been asking you to look more carefully for weeks. Tonight you finally know exactly where to look. I will see you in the very next video.